Welcome to Logical Ayurveda. Today's topic is Vipadhika. We regret the long gap in uploading videos for Logical Ayurveda due to our busy clinical schedule. From now on, we are bringing skin diseases serious. We will take one skin disease and dive deep in detail to give you the clinical clarity about the skin disease. So one such topic today is Vipadhika. Vipadhikam Panipadasputanam Tivra Vedanam is what is told in Ayurveda. People also compare Vipadhika to Palmo plantar psoriasis in contemporary science. I kindly ask you not to correlate this disease with anything rather than see this disease as an unique amsamsha kalpana of doshas causing the vyadhi, because no amount of steroid creams like beta-methasone, betanoate creams, salicylic acid, moisturizing creams or internal antihistamines and steroids can give relief in Vipadhika like Ayurveda do. Nothing can cure chronic Vipadhika as the result given by Ayurveda. Skin disease is a specialty arena of Ayurveda doctors or undefeated fort of Ayurveda. I say this after studying all other sciences and discussing with them and giving due respect to all of them. So, when we give our knowledge about skin disease, we want your unwavering focus, extreme concentration and undivided attention, because you can cure thousands of ailing patients by logically applying this dosha-based treatment. So let us take example of three patients, patient A, patient B, patient C, who come with Vipadhika but with the different complaints, how we handle all of them. So let us have a pictorial representation of all the three patients. Patient A comes to you with the complaints of plain cracked foot. He tells that he has cracked foot, he has plain cracked foot. You ask whether itching is associated with it. He says very mild itching is associated, on and off, it's not very frequent. You ask if bleeding is there, he says no. You ask if pain is there on touch or pain on walking, he says no. You ask him whether any kind of pus discharge is there from the cracked foot side, he tells no. You ask him if there is exfoliation, the skin is coming out in layers, etc. He says absolutely no. So you ask him any particular type of food or in any particular type of season it increases, he says it increases in the winter. So you ask him where does he come from, he comes from a mostly cold place like Bangalore. So to sum it all up, the patient A has plain cracked foot. He has mild itching, very mildly on some occasions. He has no bleeding, no pain whatsoever, no pus discharge from the cracked foot side. He has no exfoliation like psoriasis, etc. He tells that when dryness increases in winter, his vyadhi is getting increased. So this is patient A. Now, patient B comes to you. He tells the same complaint. He has cracked foot, but he tells, you ask him pain is there, he tells yes, there is severe pain. You ask him itching is there, yes, there is itching associated. You ask him in which particular season or due to which particular food it increases, he tells it increases in summer season. You ask him whether burning sensation is there, he tells yes. You ask him whether pimples are there is follicles that is coming near the cracked foot side and it has exudations, etc. He tells yes. So to sum it all up, patient B has cracked foot, he has pain and he has good amount of itching and it increases in summer, and around the around the cracked foot side there are pimples that are present. So now patient C comes to your clinic. He tells that I have cracked foot, I have went to multiple clinics all over the city, I have tried different types of treatment and it is not coming down. I have severe pain and severe bleeding, and severe itching is also present, and exfoliation is also present. Their skin is coming out in layers and layers. He is telling it is present since very long time. It's present since 3 years and I've tried all different types of treatment. So you're asking him in which particular season or during taking which particular food it is increasing. He tells it is irrespective of any season, irrespective of any food, be it summer or winter. There is always increase in the cracking of the foot and there is always pain that is being present, burning sensation that is present, severe itching, severe bleeding, etc. It's always present. So that is patient C. so far you would have understood what we are trying to do. So let us go back to the patient A. What kind of treatment options are there for patient A? I told you patient A comes with a plain cracked foot. He has mild itching. He has no bleeding or pain whatsoever. He has no pus discharge, no exfoliation, and increases in winter. So it increases in winter. So definitely there should be some amount of ruksha associated with. Increases in winter, definitely it is Kapha Vata. There is mild itching due to the ruksha, which is reducing an application of any moisturizer, etc. So there is no bleeding, no burning sensation, no pain. So absolutely, which rules out the involvement of any of pitha in it. So for this, so before we go into Kapha Vata, Vata Pitta, Pitta Vata, we request you to see our logical Ayurveda video, which explains in detail about the Amshamsha Kalpana of all the doshas. I am not here to repeat this again. Please go back and watch those videos if you do not understand the pathophysiology of how Kapha Vata is, Kapha Vata, Vata Pitta and Pitta Vata are formed. Now, I will only discuss the treatment options.